Hello, everyone, and welcome to the BeInfinite podcast. I'm your host, Christopher Shaw, the founder of BeInfinite.co, your all-in-one business solution to help you build a successful business. Today's show is no exception. You guys know we always bring in industry experts to help you with your options, get one step closer to your goals in life and business. Today, we have Faye Wilson, the founder of Get Insurance Today USA. She has, when I first met her, she could tell me any and everything, the ins and outs of everything insurance, and she's truly here. She has a heart to serve. And without further ado, I'm going to bring on Faye Wilson, let her introduce herself before I get you going. Hey, Faye, how you doing?
Hey, how are you doing today, Chris?
I'm blessed. You're looking good. I'm glad you have a big smile on your face. Tell us a little bit about what problem your company solves and how you're different from all these other insurance agencies out here.
Well, thanks for asking. Probably the thing that differentiates me is that I think that I do have a passion for what I do. I enjoy health insurance. It's something that I've been involved in for a little over 30 years.
Oh,
And
wow.
I think that it's something that everyone needs. As you go through life, you're always going to have to take care of yourself or a family member, a loved one, employees, and you're always going to need to depend on some kind of a healthcare system to make sure that you've got your needs met. And sometimes you need to rely on someone to help manage that. And that's what I'm here for.
Oh, wow. You just said 30 years. People, you can't buy that type of experience. I guess working with you, they can. But that is amazing for you to be in the industry that long and still have so much passion. And I know you have so much knowledge. Every time we talk about anything insurance, you teach me something new all the time. Now, one of the things that we were talking about is why you're a broker, right? You're not a captive agent, right?
That's correct.
Okay, so kind of tell us what's the difference between the broker and a captive agent. See, I said it right. And why they should choose a broker instead.
Well, a broker can represent the insured, meaning if you wanted to have an insurance policy and you go to a broker, they're going to look at you as the individual and what your needs are. What is your budget? What are you looking to protect yourself? What kind of risks are you looking to manage? A captive agent is working for that insurance company, and they're going to want to sell a specific product. They may offer you three options. I can sell you door number 1, 2, or 3. That's what they can sell you. They're looking out for that insurance company. They're not necessarily looking out for your needs. They can fit you into 3 products. Whereas a broker that is non-captive is going to be able to suit you and your needs and what is going to be best for your family, you as an individual, or your employees.
Oh, wow. So you're more of working for them and have their best interest in state instead of trying to sell you something, get some type of commission, get my paycheck back.
Yeah, that's right. That's right. And I think that it builds a much more honest relationship so that if you are buying a car, for example, if you go to a Ford dealership, they're going to sell you a Ford. If
Yes.
you are looking for any kind of car, if you go to, someone and you just describe the kind of car you want, well, there are lots of options and you can have lots of different cars that are going to meet your needs. But if you go to a Ford dealership, you're going to end up with a Ford.
And that's actually a great point. What are some of the options? What type of insurance do you cover? Can you handle anything?
Well, I like to stay in my lane. My specialty is health insurance.
Okay.
I come from a long line of people in the health industry. My dad built a lot of hospitals. I
Oh,
have four
wow.
sisters that are registered nurses. They're in all lines of health at this point. But I grew up in a family that they just talked about health, and it was fascinating to me. Um, and I just think that I've always stayed in that. I started out working in the health industry very young, and I've found that it's very interesting. To me, it's stayed interesting. So that's something that I've always been fascinated with. And I think that that has kept me interested so that every day when I wake up and go to work, I find it's a passion and it's something that I feel that I can help other people with.
Man, so you're saying the health industry is in your blood, huh? Uh,
I would say so, yes.
that's interesting to know. I want to, before I ask you these other questions, I want to do something different, a little different. Tell me something interesting or something new about the insurance, the health insurance industry that we may not know, that me and the viewers may not know.
Well, there's always new legislation that comes about.
Okay.
It's probably one of the most interesting one that's come about this past year has been balance billing. So that if you are part of an insurance, if you have an insurance company and they go through their billing process and they have determined that you no longer owe on a bill, for example, they're going to pay the doctor a certain amount and you're no longer responsible for the balance of that bill because you're on an HMO or a PPO, say a health maintenance organization or a preferred provider organization. Um, they cannot bill you for the balance of that amount that is negotiated off your bill. And some people don't know that. And if you get a bill for the remainder of that balance, then you're not required to pay that. So
Oh,
if you,
wow.
yeah, so there are a lot of different things that will come up, and it's just good to know that you're not on the hook for that bill. So it's best to, when you get that bill, the initial bill from a doctor's office or a lab or a hospital, wait for that explanation of benefits to come out that tells you what you actually owe so that you're not stuck with that balance of the bill.
Oh man, and y'all have to realize that this is insider knowledge that she studies on and she keeps up with her industry. So that is one of the biggest reasons to go with a broker as well, versus a captive agent. Whatever their boss tells them to say, kind of that's what they do. Versus you're a real student of your craft. Can I say that?
I would agree with that. Yes.
Okay.
Well, I think that part of it is um, after the sale of the policy, it's really important that you have someone that is going to stick around.
Mm.
And I think that someone that is involved in being an agent for life, um, after that sale of the policy happens, you're not going to end up with a medical card that's going to have an 800 number on the back of it so that that insured, whenever they have a question after the sale of that policy, they're going to have to call an 800 number and be put on perpetual hold.
And
Instead, they're going
transfers.
to, right, they're going to have your number and they're going to be able to call you. So if they have a question or they need help, they're going to be able to speak with you and have a live person, their agent, talk to them and help them through whatever the situation is. And that
Oh wow.
means something.
That's like a priceless benefit. That's like something that just like a caveat, like a super add-on that people don't realize until you really need to talk to your agent, right? Until
Yeah.
so
Yeah, but it shouldn't be that way. That should be the norm.
it should be, but we all know how the big companies are, especially when they have enough numbers to where they could lose a couple of people and still be okay, right?
Right.
Versus your company takes a personal approach. I love that they can call you and deal with you, and you'll handle the information. And I remember I went to a presentation where you had a wonderful presentation, and you were talking about how you will also even call their doctors. Can you kind of explain that a little more? So
Well, there is a HIPAA form involved because it's your personal private information or PPI, And you
Mm-hmm.
do need to sign a HIPAA form. But yeah, if there's information that you need help with, there are moments that I will definitely step in there and help you out, because that's what I can do to help you. Mhm.
Oh wow, that's a lot of that's a lot of service that they get from just their insurance company.
Mhm.
Now we talk to a lot of entrepreneurs on this show. A lot of our audience is entrepreneurs because that's primarily what we focus on. But you also can help entrepreneurs as well with
Mhm.
insurance. And I know that when they're a startup, what type of needs would a startup necessarily need for insurance, and what type would more of a seasoned entrepreneur need for as far as health insurance?
Well, you're always going to want to reduce your financial risk. Health is something that you're always going to want to be aware of, that you need to protect your health, and health insurance is something that you've got to be aware of. There's no way to get health insurance after the fact. We have
Uh,
what's called the Affordable Care Act. Also, at this point, it's called Biden Care, that if you have a pre-existing condition, you can always get insurance. There are special enrollment periods. There's the open enrollment. We're coming up on that open enrollment period now. There are specific dates. There are lots of rules that are involved, and you do need to be able to call and speak with an agent that can help you out with what these rules are, so that you can feel comfortable and get on a plan. Um, there are also private plans. You want to make sure that you're covered and that you have a plan, because you need to have a policy enacted before you have an injury or an accident. If
mm-hmm.
you don't have a policy, then you're going to be looking at going to um, a health clinic in your community or a community hospital. That's not a big problem or an issue. However, you do end up waiting in line. It's maybe not the most convenient thing. And, most people would rather have a regular treating physician and go through regular health checkups. That's usually what they'd rather do. So there are some benefits to having that. Also, you probably want to get on a regular regimen of, good wellness benefits, and be on a policy, so that if something happens and you're going to be off work for a while, maybe you're going to have a policy that will contribute to your monthly income, so that you're not going to be out of work or out of a monthly income, so that you can continue with your lifestyle. There are supplemental policies that help you with this. There are policies for dental, vision, if you need LASIK, if you need to cover, if you have a policy that has a deductible, there's a policy that can cover that deductible. There are policies that can cover emergency room fees. There are policies that can pay a supplemental if you have something like cancer, heart attack, stroke. There are policies for all of these. There's even a policy that can cover if you have a max out of pocket on an Affordable Care Act benefit. So there are so many ways,
Options. Yeah.
customizable options that can work for you. And even if you do have an Affordable Care Act plan, there are subsidies that are available that can make it more affordable for you based on your income.
Oh,
And
okay.
if,
So you. Oh, sorry.
yeah, and if all of this sounds confusing, and that's layer upon layer of information, the best thing to do is to just contact an agent or contact me, and
Okay.
I'd be happy to find out what your personal needs are, what your budget is, and how we can accomplish that depending on what your situation is.
What? Okay. Let's go ahead and plug that then. How would they get in touch with you?
Well, I have a website, and the
Yes.
website is getinsurancetodayusa.com, or my email, getinsurancetodayusa@gmail.com, or they can contact me by telephone. And that's on my website at 214-592-3484. I'm in the Metroplex, but I'm also licensed and appointed in multiple states, and I represent multiple carriers so that I can give you the option of many different plans, both federal plans, also private plans, to give you the most benefits available.
Okay, man, you know one of the things that people are looking for when they do insurance or looking for insurance is budget. And you said multiple times in this interview that you work with their budget. How does that work? Is there certain let's say somebody has a lower budget? Is there a certain industry or insurance plan that is your go-to, or can you still shop around and, like you said, find subsidies to kind of offset that price?
Well, yeah, on the Affordable Care Act, the subsidy can help them to make that plan affordable. So if their income puts them into a position so that they can't pay very much, it's based on their annual income. So that's very beneficial, especially if they have pre-existing conditions. Now, if someone has an income that puts them over the level of having a subsidy, then there are plans that are private or guarantee issue plans that can help them to lower that monthly premium, and that can also help them. So maybe they've got some other expenses, even though their income is high, or maybe they just don't want to put that much money into their monthly premium. There are some ways that we can find a plan that is more affordable for them. So there are lots of things to take into consideration, and we like to listen to what your needs are, and we can find a plan that's more affordable. So depending on what your needs are, we can help you find a plan.
Wow. So it's super customizable. And people don't understand that sometimes, I think, especially going through I went through this. I remember when Obamacare, I know you call it Biden care now, but when it was Obamacare, when the website first got up, I went through all those things, man, it was so many plans. It was so confusing. And what your company does is make that simple, because if they have a free consultation with you, would you kind of walk them through, or let's take that back. You would already know, based on the information through that free consultation that they get with you, where they kind of can, you can go back and do your research, and then you can come back with multiple plans, and then you map them out for them so they wouldn't have to navigate that website with all these different plans on it. Kind of tell us, what's your process? So let's say someone's interested. What kind of process do you walk them through to get them insured?
Well, normally it's based on their zip code regionally. Okay. That's the first step. Date of birth, because your age and where you live, that's very important. The next step would be looking at their financial situation, if they have any pre-existing conditions. And the reason why that's important is some plans, if you are very healthy, you do get a discount on your health. And the reason for that is it's very similar to, say, you're buying an auto policy. So someone is an excellent driver, no DUIs, no speeding tickets, no accidents. Well, you're going to get a discount on that auto policy. It's very similar with your health insurance. So if you're extremely healthy, you get a discount on your health. So you can get a lower monthly premium on that. So that being the case, I can shop for policies that give you a good health discount. Those are in the private sector, private plans. But if you have some situations, maybe you've got something more serious, maybe you've had cancer, or you currently have cancer, you've had a stroke recently, well, then you're going to need a plan that allows for pre-existing conditions. And because of the Affordable Care Act, there are some great plans that allow for that, or guarantee issue plans. Guarantee issue plans allow for, say, the last 12 months. They would allow, actually, last 12 months, if you've had something going on, it would preclude that one pre-existing condition. But the Affordable Care Act plan would allow anything immediately. So there are lots of considerations. The next thing would be maybe height, weight. Maybe you travel a lot. If you travel a lot, then you would need a national PPO so that if you go beyond your local region, that you would be able to see someone without having to pay more for your out of pocket. So if you have an emergency, maybe anything other than life-threatening, of course, that emergency is going to be covered wherever you are. But if it's something less than life-threatening, you're going to pay more even if you're on what you would consider to be a large national PPO. It has to be truly a large national PPO because some of these large companies are actually franchises. And if you leave your local region, you're going to have to pay more out of pocket. So there are a lot of things to consider, and you want to make sure that you're not missing something in the writing of your policy. There are lots of things to consider. So at that point, then looking at all of that and what they're accustomed to, what they like about their policy, what they don't like about their policy, then I would look at what is available for them. And then maybe come up with 2 or 3 different policies and compare and find out what they would like.
So you go back and do all the research for them. Is she saving you time and headache? Because that's a peace of mind. That's it. Like I said, when I first saw that website, and we do websites, so we wanted to see what the whole fuss about, because it was all over the news and it was confusing. Oh my gosh. I was like, man, the industry, if we just had somebody that could really navigate this for us, and that's exactly what Get Insurance Today USA does. They get it. And before we go on, you guys can see at the bottom that Faye's, all her information is at the bottom, so you can contact her. And also this podcast is live, so you guys can put comments in the comment section on Facebook and YouTube, and then Faye will answer your insurance questions, right? This is all about Faye Wilson today. I do have another question. So a lot of times people, I'm so glad you brought it up earlier. A lot of times people don't think about insurance till after the fact, right? So Can you kind of, from your years of experience, can you kind of tell us, not naming any names, but from your experience, what is the true cost? Because like I said, we're always trying to find the best price versus what we really need. And so what is the true cost of not having the right insurance plan, from your expert opinion?
Well, I've seen some people pay maybe $2,000, $2,500 a month for a plan, which to me is exorbitant.
Yeah, that's a lot.
It is a lot. That's another mortgage payment. And I've gone in and found them a better plan, a more effective plan that will cost them maybe $1,000 a month.
Oh, and wow.
Provide them with a better provider network, provide them with better hospitals, and less out of pocket when you go to see the doctor. I know that some of these plans, every time you go see the doctor, it's $40 or $50.
Yes.
Lab work is very expensive. And that better plan, not only do I save them about $12,000 a year just in premiums, but their max out of pocket is taken down to $3,000 instead of $18,000 to the family. So we're looking at a significant amount of money. And then normally they will talk to their financial advisor and use that money toward maybe a college education fund for their children or a retirement fund.
Wow.
So we are looking about an exchange of a significant cash value. That's, to me, very fulfilling, that I have helped them to accomplish something and gotten them better care. The other thing is I look at healthcare as a consumer-driven feature instead of what has become the 6th largest industry in the world, where instead of having healthcare be a money-making feature, I think that it should be consumer-driven. And instead of every time that someone goes in and has maybe gallbladder surgery, that it's automatically a $56,000 procedure. It should be something more in the line of $8,000. And when you look at an explanation of benefits after the fact, and you see that they've written off around $40,000 for that procedure, where does that $40,000 magically go? Well, as a consumer, you have to realize, well, maybe that's why the cost of your insurance has escalated over the last 10 years. Maybe that's why we see that insurance doesn't have to be that expensive, and why some of these private plans are working for the consumer. And some of these indemnity plans are doing more for the individual. And so there are some plans out there that are working in that direction, and it's very interesting. And you can work in that direction. And those are some of the interesting plans that are definitely worth taking a look at from a consumer perspective.
You said, Faye, you just told us that you help these people put their kids through college, right?
Well, I've learned that money doesn't grow on trees.
No.
And sometimes you have to take it and take a good look at what you're doing with your money. And, I've seen some of these situations come up where someone has a chemotherapy treatment. They automatically put that individual that is going through cancer, as they go through the hospital, their bill is assessed at $250,000. Well, it doesn't have to be that high. There are some things to take a look at as far as what the costs are, the actual costs are, and what the predicted costs are, what your bill is actually going to be, and why the explanation of benefits is different than what the treatment costs are on that, or what they're expected to be in a hospital. So there are some very interesting values. So.
And one of the things that you do so well is lay out these options for everybody. Because like you just said, somebody's paying $2,500 a month for insurance. You looked over their policy and said, I can get you better coverage for half the price. So evidently, whoever it was who sold them that insurance didn't go through as many options as possible, or they were looking to just sell them some. So with you go through all your options and really do your due diligence in helping your clients and working for them, right? So that's the gist, because the stories you're telling are amazing. $2,500 for and not even getting the best coverage. Oh man, I would be mad. Yeah. I would be really mad. And you're right. That money can go towards, building my wealth,
Right.
And other places where it needs to go. I see that is the true cost of not knowing your options. And Faye, before we go, because we're almost out of time, I want to plug your new podcast coming out, and it's Know Your Options with Faye Wilson. Now, you're not going to be talking about insurance. You're going to be talking about knowing different options in different industries as well, right?
That is correct.
Oh, wow. So we're going to tune into your podcast, and then we can learn about knowing your options if you bring on a petition or a contract or people who really have that same way of thinking when dealing with their customers, basically.
That's right. Yeah.
Oh, cool. We can't wait to have it on there, to have your podcast coming out. And once again, you guys can check out Contact Faye. She well, let me say this before we go further. Let's say they have an insurance policy already, they bring it to you, you'll examine that and go through their options as well, correct?
Yeah, absolutely. Okay. It's surprisingly an easy process to go through. I've looked at policies for years, and I can take a look at yours and let you know if you do suffer a financial risk. It's not that complicated. I'm used to looking at these, and it would only take me a few minutes to take a look at yours, explain what you might be missing. It doesn't cost you anything, and possibly put you in a better plan than what you currently have.
And what if that's the best plan? What you gonna tell them?
I would say then you're doing great and continue with what you're doing.
All right, that's what we like to
Yeah,
hear, man. You're
they haven't
someone we
lost,
trust.
they haven't lost anything, right?
Oh, that's good. Okay, man, it's been a pleasure having you on. I know this is a long time coming, but we had you on, and I just wanted people to know who you are, introduce you, and realize that the insurance industry isn't all smoke and mirrors. That there are people that are really fighting for you and really care. And Faye Wilson has a whole company. She's building a whole company that's gonna really do that for you guys and entrepreneurs too. So you do business, family, and individual, correct?
That's correct. Yeah.
Okay, great. So she can help any and everybody find the best insurance for your budget. You know, most people aren't worried about your budget. They're trying to put you in the budget that they want you to put there, whether it's a financial strain on you or not, right?
Right.
She can help you budget. And I remember in your presentation too, you said Medicaid.
Medicare.
Medicare.
Right. Yeah.
So you can help people no matter what their financial situation is. That's amazing. You usually don't hear that.
Yeah. Over 65.
Okay, so over age 65, you can call her as well, and she'll help you out as well. So Faye, it was a pleasure having you. You have some closing words. You want to tell them one more time your information before we get out?
Yeah. It's been a pleasure speaking with you, Chris. Thank you for inviting me here today. And yeah, it's Faye Wilson, Get Insurance Today USA. You have some customizable, affordable options, and give me a call. A policy review takes just a few moments. Thank you for your time.
Okay, thank you guys. Thank you once again. Also, before we go, you guys can go to our website, BeInfinite.co, download our free magazine, digital marketing magazine as well. And we're out till next week. Thank you.